Hello there. Welcome. Today we're having an honest chat, a frank discussion about men's health. It's a topic that's often shrouded in silence, but it's vital that we bring it into the light. Specifically, we'll be focusing on the penis, those fascinating erections, and what happens when things don't go as planned. We'll explore some common concerns and offer some insights. Understanding your body, knowing how it works, is the first and most important step to taking care of it, to ensuring your well-being. No shame, no embarrassment, just knowledge. We're here to empower you with the facts. The penis, a complex and sensitive organ, is made up of the shaft, the highly sensitive glands, the head of the penis, and the urethra, the tube which carries both urine, waste from the body, and semen, essential for reproduction. Most important for erections, for achieving and maintaining them, are two spongy chambers called the corpora cavernosa, which fill with blood. Erections, or the lack thereof, can be an early warning sign, a red flag for other underlying health issues like heart disease, a serious condition affecting millions, or diabetes, a metabolic disorder impacting blood sugar levels. Paying attention to your sexual health, being proactive about it, is directly related to paying attention to your overall health and well-being. Let's break the stigma, shatter the silence, and talk openly and honestly about these important issues, because knowledge is power, and understanding your body is the first step to taking control of your health. By the end of this discussion, you'll feel more informed, more knowledgeable, and more confident about this essential and often overlooked part of your health. So what exactly is an erection? It's a question many ponder, often with a mix of curiosity and perhaps a touch of embarrassment. But let's demystify it. In simple terms, it's when the penis becomes firm, elongated, and stands away from the body. It's a visible sign of a complex physiological process unfolding beneath the surface. Erections are automatic, triggered by the brain and the intricate network of the nervous system. Think of it as a chain reaction, starting with a signal from your control center, not something you consciously control, like moving your arm or wiggling your toes. It's part of the autonomic nervous system, working behind the scenes. The process involves your brain, the command center initiating the cascade of events. It all starts with a thought, a feeling, or a physical sensation. Hormones, those chemical messengers that play a crucial role in regulating bodily functions, including sexual function. Nerves, the electrical pathways carrying signals throughout your body, and blood vessels working together in perfect harmony. When aroused, whether by physical stimulation or mental imagery, the brain sends signals like dispatching a fleet of messengers. These signals travel down the spinal cord to relax muscles in the penis, specifically the smooth muscles that control blood flow. This relaxation allows blood to flow freely into the corpora cavernosa, two sponge-like areas within the penis. The blood rushes in, filling these chambers, and gets trapped, causing the penis to expand. This engorgement of blood makes the penis rigid and erect, ready for sexual activity. Think of it like filling a balloon with water, the pressure building as the water fills the space, and pinching the end to keep it full, water from escaping, and maintaining the balloon's inflated state. When arousal ends, whether naturally or after ejaculation, the process reverses, the muscles contract, the blood flow decreases, and the penis becomes soft and returns to its normal, flaccid state again. This quick, efficient system is a sign that everything is working as it should. It indicates that your blood vessels and nerves are healthy and functioning properly. Erections are a natural part of life, a normal physiological response, and a good indicator of overall health, especially cardiovascular health. Understanding this process helps you recognize when something might be off, prompting you to seek medical advice if needed. It's about being informed and proactive about your health. Erections serve several purposes. Biologically, they allow for sexual intercourse and reproduction, but they're also about pleasure, intimacy, and emotional connection. Erections can happen without sexual thoughts, like morning wood, which is your body's way of keeping tissues healthy. Spontaneous erections, especially in younger men, are normal and often caused by hormones or random nerve signals. Even friction from clothing or a full bladder can trigger one. Erections are a sign your body is working as it should. They're about more than sex. They're about health and well-being. Let's talk about erectile dysfunction, or ED. ED means regularly struggling to get or keep an erection firm enough for sex. It's normal to have occasional issues. ED is about a persistent pattern. ED can show up as trouble getting, keeping, or maintaining a firm erection. It's a medical condition, not a personal failing. Stigma keeps men from seeking help, but talking about it is the first step to solutions. ED can affect confidence, relationships, and mental health. Open communication with your partner is key. Remember, ED is common and treatable. It usually has more than one cause. Physical, psychological, and lifestyle factors all play a role. Physical causes include poor blood flow, nerve damage, diabetes, heart disease, and certain medications. Psychological causes include stress, anxiety, depression, and relationship issues. Performance anxiety can create a frustrating cycle. Lifestyle choices matter. Smoking, heavy drinking, poor diet, and lack of exercise all increase risk. Obesity and inactivity can lead to conditions that cause ED. The good news, many causes are treatable or reversible. Addressing these factors can improve both your sexual and overall health. You have the power to make positive changes. If you're experiencing ED, you're not alone. It affects millions of men worldwide of all ages. About 40% of men experience some ED by age 40. By 70, it's up to 70%. ED is more common with age, but younger men can experience it too, often due to stress or lifestyle. Knowing how common ED is can help you feel less isolated. Doctors take ED seriously because it can signal other health issues. Seeking help is a sign of strength, not weakness. You deserve support and solutions. The best news of all, erectile dysfunction is not a life sentence. In fact, ED is highly treatable in the vast majority of cases. The journey to recovery starts with a simple yet crucial step, talking to your doctor. They're there to help you navigate this, offering guidance and support, not judgment. Remember, they've heard it all before. Often simple lifestyle changes like quitting smoking, which can significantly improve blood flow, eating better, focusing on a balanced and nutritious diet, exercising regularly, incorporating both cardio and strength training, and reducing alcohol consumption can make a surprisingly big difference in your overall health and sexual function. When lifestyle changes aren't enough, medications like sildenafil and tadalafil are safe and effective for most men, offering a reliable solution. However, these medications do require a prescription from a healthcare professional, and there are other options to explore, including vacuum pumps, which can be a non-invasive alternative, injections directly into the penis, or even hormone replacement therapy via pellets. Your doctor will guide you through the pros and cons of each, helping you make an informed decision. If underlying stress or anxiety is identified as the primary cause, engaging in therapy or counseling sessions can be incredibly helpful in addressing these emotional factors. Furthermore, couples counseling can be beneficial, helping to strengthen your relationship and tackle ED as a team, fostering open communication and mutual support. Remember, the most important first step is reaching out for help and acknowledging the issue. With the right approach and support, a healthier, happier sex life is absolutely within your reach. Welcome to my YouTube channel. Don't forget to like and subscribe.